Epilepsy is the most common neurological condition in South Africa. 1 in every 100 people has epilepsy, and despite its high incidence, it's still largely misunderstood. It's important that we know exactly what epilepsy is and how to manage this condition. With me in studio is Dr. Darren Green to help us discuss epilepsy. Welcome, Dr. Green.
Sure, thank you.
Thanks for being here.
Thanks.
So, Darren, what's the definition of epilepsy?
Simply put, it's the tendency to develop seizures, and it comes about as a result of an epileptic focus on the surface of the brain that goes through a period of erratic or irregular conduction of electrical impulse or signal. And that's when you develop the secondary effects, which can range from just a simple stare in absence seizures all the way through to those tonic-clonic jerks.
Epilepsy isn't a general condition, and there are actually a number of different types of epilepsy syndromes. Doctors will determine the type of epilepsy based on the cluster of symptoms. An important aspect of epilepsy is that while some people are born with it, it's also possible to develop epilepsy through brain trauma.
So what is the treatment for this?
We look at a host of anticonvulsants.
Yes.
Some of them are known with dramatic side effects, and what those actually do is they work on the thresholds of nerve conduction.
Yes.
So epilepsy, being an electrical impulse disorder, involves us altering the threshold for seizures. But there are other simple ways of treating epilepsy as well, and one of them are to sleep enough, for example. Enough sleep, good exercise, looking at your diet, and when all medical treatment has failed, and sometimes even surgical treatment, people rely on diet.
So what are the stigmas with epilepsy?
For many years, I think a lot of people have considered it a death sentence in terms of social death, sports death, and even schooling. And there certainly is an association of uncontrolled epilepsy with hampering your normal lifestyle. The impact on someone's life can be devastating if it's uncontrolled.
Yeah.
What people need to realize, and the stigma we can change, is that it's a treatable condition. And depending on the exact cause, obviously, some of it reverts quite quickly and we can treat it rapidly. There are those, however, that are resistant cases, but technology has developed to a point now where we can actually treat it and you can lead a safe, normal life.
Like, for example, John Tiro, it's well-known epileptic. Later we talked to Kai Fitchen as a young man who's just like summited some of the biggest mountains in the world.
Incredible. Hats off to him. Good role model.
So Darren, a guy collapses in a busy marketplace. How do you know he's actually having a seizure? Can you describe a seizure?
They'll drop to the ground with low tone. Their muscle tone is floppy and they just collapse.
Yes.
And they have twitching and jerking movements of their arms and sometimes even their legs. You often notice the mouth starts pulling and twitching as well. Yes. Frothing or hypersalivation.
People often want to put something in the mouth.
Yes, to prevent them biting the tongue. And a lot of people do. They put a sock, hopefully not a stinky sock, but whatever they can find in the mouth to try and prevent that. We found that that often can suffocate the person that's busy thrashing around, and they can actually block the airway. So be careful. Dentures, for example, are something quite simple to actually remove because they can swallow them. And they can also cause problems.
Actually, you shouldn't actually try and put anything in the mouth, but if you do know that a person who's having a seizure has dentures or something, we should actually remove it to keep the airway open.
Correct. Yeah. And then the best thing to do is to basically protect them from injuring themselves while thrashing about. So look around you, look at the environment. Are there any sharp objects? Are there any bricks, stones, whatever? And then obviously stay with them. Turn them onto their left side, which we call the recovery position.
How long will the seizure last first, usually?
Mostly, they rest after about 1 to 2 minutes.
Yes.
With complex cases, they can carry on for up to 5-10 minutes. And the ambulance, someone should alert the ambulance immediately while someone else is protecting them from injuring themselves.
Is epilepsy a life sentence, or can you lead a normal life?
Certainly not. I believe people can have an exceptional life if they take responsibility, but also understand the condition better. And I think with where science is at the moment, and also the multidisciplinary team approach to treating epilepsy and the involvement and education of parents, teachers alike in our communities, I think we are removing that stigma quite rapidly. And there's certainly some good characters out there that are proving that to the world.
Thank you so much for joining us, Darren. If you want more information on epilepsy and for services and support for those living with epilepsy, contact Epilepsy SA. You can visit their website at epilepsy.org.za.